Hello again. In this video, I will talk about two aspects, the embryonic development of the skull as well as the joints of the skull. So to begin with, let's briefly look at how the skull develops in the embryo. Just brief. It's a complicated process and takes quite some time. But here I'll just briefly summarize the development of the skull in the embryo. So skull embryonic development normally can be divided into what is known as the neurocranium and the viscerocranium formation. And this starts around the third or fourth week of gestation. So the neurocranium growth leads to the craniovault development via what is known as intramembranous ossification, whereas the viscerocranium growth leads to facial bone formation by what is known as endochondral ossification. So intramembranous ossification directly converts the mesenchymal tissue to bone. So the intramembranous ossification directly converts the mesenchymal tissue, the mesenchyme, into bone tissue. And this forms the flat bones of the skull and also most of the cranial bones. So that's the intramembranous ossification. Then the endochondral ossification begins with the mesenchyme or the mesenchymal tissue transforming into a cartilage first, which is just a cartilage intermediate, which is then later replaced by bone. And this forms the remainder of the axial skeleton, meaning the vertebral column is also formed in this manner, and also the long bones of the body of the animal. So those are the two types of ossification that occur in the skull. That's intramembranous ossification as well as endochondral ossification during embryonic development of the skull. Now, what you may be wondering what mesenchymal tissue is or mesenchyme. So mesenchymal tissue or mesenchyme is just a type of loosely organized animal embryonic connective tissue of undifferentiated cells. And these cells give rise to most of the tissues such as the skin, blood, or indeed bone. The interactions between the mesenchyme and the epithelium do help to form nearly every organ in the developing embryo. So the mesenchyme is really an important tissue of the embryo in that it leads to the formation of other tissues. So there you have it briefly on the development of the skull within the embryo. Now I'll talk about the joints of the skull. So the joints of the skull are generally known as sutures, spelled Sutures. These are fibrous joints, and this means that they are united by fibrous tissue in such a manner as to practically not allow any movement at all. This is after ossification, of course. Therefore, the joints of the skull are often termed as fixed or immovable joints. And most of the joints of the skull are temporary, meaning that the uniting medium is eventually invaded by the process of ossification, resulting in what is known as synostosis. And synostosis is just a fusion of two or more bones. So in this skull, which is the skull of a young goat, you can see the sutures here, which have these serrated edges here. That's one suture there between the frontal bone and the nasal bone. So you can see that suture. There's another suture there between the two frontal bones. There's also another suture there. So this is typical of the joints of the skull. Now, in most suture joints, the edges of the bones have irregular interlocking margins, which form what are referred to as the sutura serrata. So this is what I've just been describing here. So these are the serrated margins that form these sutures. So in summary, sutures are just non-moving joints that connect bones of the skull, and these joints have serrated edges that lock together with fibers of connective tissue. So the fibrous articulations between the teeth and the mandible or the maxilla, as you can see here. There is also some joints between the teeth. These are the teeth here. And also, for example, the mandible. Sorry, the maxilla. So the mandible also has some teeth embedded in it. We can't see it here. I'm going to show you in the other video. So there is also a joint between the teeth and the maxilla, for example. So that joint is called the gomphoses, and several of them are referred to as gomphoses, spelled Gomphoses. And these joints are also immovable. So in life, they are normally immovable. So there you have it, the brief embryonic development of the skull and also the joints of the skull. Thank you for watching.